We're delving into a fascinating study on surgical knots, which are absolutely crucial in large animal surgery, especially for procedures like castrations. Preventing postoperative bleeding is paramount, and a secure ligature using strong suture material is often the answer. However, tying secure knots in deep surgical cavities or during laparoscopic procedures can be incredibly challenging. Traditional square and surgeon's knots often require precise, individual tightening of each throw, which is tough to achieve in confined spaces, potentially leading to insecure knots. This inherent difficulty highlighted a significant need for a more reliable, self-locking knot that could be easily slid into place and remain secure.
Indeed, and that's precisely where the double forwarder knot comes into play, building on the concept of the original forwarder knot, which provides a secure start for continuous suture lines, but can't form a full encircling ligature. This new double forwarder knot was designed to allow both ends of the suture to be individually tightened and locked. The primary goal of this laboratory study was to thoroughly evaluate the strength, specifically the knot holding capacity, and the physical size and weight of this novel double forwarder knot. The researchers then compared these characteristics to the more established surgeons and square knots, using common suture types. Their hypothesis was quite clear. They expected the new double forwarder knot to demonstrate increased knot holding capacity and, due to its design, also predicted it would be larger and heavier.
The results of this rigorous study were quite insightful, especially regarding knot holding capacity. For 2 USP polyglactin 910 suture, the double forwarder knots consistently exhibited a higher knot holding capacity than both square and surgeons' knots across all numbers of throws tested. With 3 USP polyglactin 910, the double forwarder knots also showed significantly higher knot holding capacity compared to all square knots. Interestingly, when comparing the double forwarder knot to surgeon's knots in 3 USP polyglactin 910, the double forwarder knot maintained a higher knot holding capacity with fewer throws. However, once surgeons' knots reached 6 to 8 throws, their holding capacity became comparable to the double forwarder. A notable finding was that none of the double forwarder knots failed due to unraveling, a common issue observed in some square and surgeons' knots with fewer than 6 throws. This suggests the double forwarder's unique self-locking design is very effective.
That's a key takeaway, as the self-locking characteristic of the double forwarder knot prevents unraveling, contributing to its superior strength. The study also confirmed the hypothesis regarding size and weight. Double forwarder knots were indeed significantly larger and heavier than both square and surgeons' knots when comparing the same number of throws. This larger knot size could potentially lead to increased tissue reaction in a clinical setting.